is Pam Valdez. I'm the ADHD coach at Next Step, and thanks for having us here today. Let me go ahead and advance the slide. The first topic I want to discuss was organization and overwhelm. Overwhelm is probably the word I hear most often in coaching with kids and actually adults too with ADHD. It's an important topic because overwhelm it's sort of a shortcut to exacerbating every symptom of ADHD. When we get overwhelmed, it's harder to focus, harder to concentrate, harder to remember things, harder to get started on things, and so on. So it's really important to have some strategies in place to not only manage overwhelm, but hopefully to learn how to prevent it in the first place. And organization is closely related to that because that refers to having a system in place to help you remember and track the things that you need and want to do. So when we don't have a system that works for us, or we're not working the system, we tend to get overwhelmed. And so those two are very closely related. And so I've noted here a few strategies that can be helpful. By far, when it comes to overwhelm, probably the most common and effective strategy is breaking things down. So things can be broken down in a number of ways. If there's an assignment for school that has to be done, for example, it can be broken down by time. Don't know if many of you may be familiar with the Pomodoro technique, but it's kind of a fancy name for a very simple concept, which is using a timer to time the amount of work and then give yourself a timed break. The original Pomodoro was 25 minutes on, 5 minutes off. But what I always tell everybody to do is you do you for that particular task. If you've got 10 minutes in you, set it for 10 minutes. The longer your work period, the longer your break, and so forth. Also, very important that you choose an activity for your break that leaves you feeling refreshed, like, oh, I needed that. I often recommend, I guess I always recommend that people avoid technology during their breaks because technology just tends to suck us in. And the time goes by so fast, and we think it's been 5 minutes, but it's really been 25 minutes. And it also doesn't tend to be super refreshing. It leaves us feeling a little bit cheated. Oh, I'm not ready to stop that because technology is really good at holding our attention to the next upcoming thing. So the Pomodoro technique is one way to break things down by time. You don't have to do this, but a lot of people find use of a visual timer is helpful. And I don't know if you are familiar with that, but they're wall-mounted ones and little small ones. And what happens when you turn the timer on, there's a color bar. So you'll, like for 15 minutes, a quarter of the display would be blue, for example. And then you could see that color disappearing as the time goes on. For some people, it's just kind of magical. If they're visually oriented, I've had kids and adults both say, "Wow, I don't know what it is about that timer. It just really works for my brain." So that's what all of coaching is about: is finding out what works for your brain. So that's one way to break things down. But another way to break things down is by breaking the task up into separate tasks. Everything can be broken down, and kind of the rule of thumb is if step number 1 still feels impossible, you find yourself staring at it, break it down further. I literally have had people say, step 1, sit down at the desk. Step 2, open a Word doc or whatever it happens to be. Gather my supplies. And then the other important part of that is acknowledging that step that you've just taken as a little win. All right, check, I did that. I sat down at my desk. I gathered my supplies. And to be able to do that just helps build some momentum. I'm on the road. I can see the progress. I'm ready to do the next thing. So that's one strategy really important for overwhelm. Let me go back up to the top of the list, developing routines and habits. That can be really helpful. Often with ADHD, there's sort of a love-hate relationship with structure. But routines and habits can just be so helpful. And I'm sure most everybody in here either has kids or teaches kids with ADHD. And when they are prepared for what's coming up, it can just be so much more helpful than when they're caught by surprise, because that can lead to overwhelm. So, for example, classroom. They come in, they know every day I come in the classroom, my teacher's going to greet me. I'm supposed to sit down at my desk. I'm supposed to go to my cubby and put these supplies away. Those types of routines can be really helpful. Things that they don't have to think about, they can just put into motion. So routines and habits, and at home, same thing. having, sometimes for kids, having a checklist, adults do, can be helpful. For little kids, it's helpful if that checklist is perhaps pictures instead of words. It's really important that the checklist has a number of items on there that feels manageable to the child. And that's different for every person. Could be 3 things, and that's max. Then that's fine. You do 3 things. So others, it might be that they need everything on there. They want to see it all. So again, it's about finding what works for their brain. And then making it visual. That was an example of making things visual. Kids with ADHD, and again, adults as well, not always, but often find that when things are visual, it just makes more sense to them. It's really important to get things out of their head and capture them some way. Pen and paper, such as an agenda, for example, depending on the age of the child, or a digital format. Again, just going with what works for their brain. But making things visual can be really, really helpful. Another example of that is, suppose there's a child in a classroom that has a really hard time blurting things out. You might consider taking a picture of the child sitting, raising their hand appropriately for a question, and then being able to print that out and have them tape that to their desk so they can see a visual. This is what I'm supposed to do. And they literally see themselves doing that. Consistency, there's kind of a joke within the ADHD community. The only thing consistent about ADHD is inconsistency. So there is some truth to that. But most people strive for that. And the more we can have some consistency, the better. But another important component of that is to expect some inconsistency and to learn to recognize that that's not a fail. That's perhaps I'm off track. And to have a get back on track plan in advance can be really helpful. That might be for homework, or it might be for, the evening routine. But to have a get back on track plan can be really helpful. I'm off track. What do I do now? Oh, here's my plan. And again, if that plan can be visual, that's helpful too. So anytime you can have things be more consistent and so they know what to expect, that can be helpful. Let me go ahead and advance to the next slide. Task initiation is kind of a fancy way of saying not procrastinating. So procrastination doesn't apply to everyone with ADHD, but it is super common. Along with this, and I'll go into this in just a minute too, is self-talk. And self-talk is also very important. And the reason why I bring it up with procrastination is when we procrastinate, there tends to be a lot of self-talk going on in our head. And most of that is not very friendly talk. So it's important to find ways, strategies to put in place to help you or your child get started on the things that they want and need to do, but also find ways to communicate with themselves that helps them take action. And I'll give you an example of this. Think about a day when maybe you were struggling, you were scattered, you weren't getting things done, and maybe you felt kind of paralyzed, but for whatever reason, or things were happening, and unexpected events occurred, and you weren't getting things done. And think about what that felt like. Usually people say it was frustrated, it was upset. And think about, how did it make you feel about you? And children and adults with ADHD almost always respond, it made me feel bad about myself, because they've had that feeling and experience way too often in their lives, and they go through here I go again. This is not just today. This is me. So the next question I usually ask is, and how does that affect your ability to do the next thing in front of you? And almost without exception, the answer is, well, it's nearly impossible. So it really matters what goes on in our head. If you think about the opposite kind of day, when you think, hey, I'm kind of on a roll here. I'm getting things done. This day's going well. And that usually makes us feel good. And it makes it easier to do the next thing. The word I hear most often with that is momentum. I feel like I got some momentum going. I feel like I can do the next thing. And that's what we're looking for, isn't it, with our kids, is we want them to feel like they can do this. We want them to be able to see what's possible, not focus on what they are telling themselves they cannot do. So to that end, it's really important to teach them, not just to tell them what they can do, but to teach them to tell themselves what they can do. We all like to hear good things. We like for people to praise us and reinforce good things, but what really matters is when we can do that genuinely with ourselves. Because if someone says, you're doing a great job, and in our head we're thinking, no, I'm not, or it's just lucky, or it's all going to fall apart in a minute, it doesn't feel the same as if someone says, you're doing a great job, and you think, yeah, I really am. So learning to focus on those, that's really important. So some specific strategies with getting started with tasks: adding interest. ADHD brain is a super interest-driven brain, and if the task at hand is boring or mundane, super long perhaps, or just we flat out don't like doing it, makes it really hard to start. So there's different ways to add interest. Environment is one that matters. Sometimes it is very different for every person, but sometimes being with another person, there's a term called body doubling, which is kind of a weird term, but it just means someone else is present. There's a reason why people work in libraries or go to coffee shops. It's the busyness around them that they like, that puts them in work mode but does not distract them. And it's different for everybody. Some kids need to be alone and have it perfectly quiet. Other kids do best if there's someone with them, and it doesn't necessarily even mean that that person is interacting with them or working on the same thing. For some kids that helps, but other kids, homework for example, they might do best in their room alone. Others might do better in the kitchen where a parent is also present, but not necessarily talking to them. So having them begin to explore, what do I need? What would help me? I often ask them to complete the sentence, I think it would be easier for me to start on this if only fill in the blank. And that might be someone else was here, or I was near a sunny window, I was in a different room, I got a cold drink. It doesn't matter what it is, but thinking about involving all the senses you can. Music is another one. Music can be really helpful and put kids in work mode, or it can distract. And that might be for the same child. Would music help you right now? Would it distract you? I had one young man who learned through experimenting that when he did math, he listened to fast-paced classical music. He didn't even particularly like classical music, but he found that really helped his mind work for math. So he experimented, and that's what all this is. There's a lot of experimentation. The good news is that the ADHD brain is usually really good at thinking outside the box, but it does that best for other people. So helping the child learn to do that for themselves. How can I use my imagination to figure out what would help? And it's often helpful to ask them, okay, what would you tell your friend if they were struggling to get started with their homework, or if they were struggling to get their room clean, or whatever it happens to be? And often they can come up with an answer pretty quickly then, to take themselves out of it and then to try to put that into place, help them put that into place. The well, of course, and this can be really helpful when a child is procrastinating and having a hard time getting started on something. The first part is giving yourself some empathy. Well, of course I don't want to do this thing because fill in the blank. I don't like it, or it seems like it's going to take forever. I don't know how to do it. Fill in the blank. And I want to. So that's encouraging them to find the choice in the matter. Why do you want to do that homework? And usually it's because I want to make a good grade. I don't want to get in trouble. But tapping into why they do want to do it. And then the next part of that is picturing themselves doing it. Have them actually see it in their head like a movie. Kids with ADHD are really good at seeing the potential negative consequences because they've experienced that, and too many times. And so they can see it and sometimes even expect it. And so teaching them to see yourself doing that thing. What does that feel like? How are you going to feel once you do that? Often we intuitively do this with our kids. Come on, do this thing. You're going to feel great. You're going to love this, and you're going to feel so proud of yourself when you do it. So teaching them to do that with themselves. How are you going to feel when you start your homework? How are you going to feel when you finish it? and then really encourage them to recognize that as a win. Actually, that's a really big win. When you do something that's hard for you, doesn't matter if it's easy for other people. It's a big win. So that's the well, of course, and then the acknowledging effort, progress, and successes, kind of self-explanatory, but again, teaching them to do that for themselves, not just being results-oriented, but effort-oriented. Let me go ahead and advance it to the next slide. Emotional regulation, again, not an issue for every child with ADHD, but super common. One of the things I find most helpful there is what I call the power of the pause. Teaching the child to pause. The brain only needs a few seconds to be able to see that there's an alternative to their immediate reaction. But it's not an easy thing. It's a simple thing, but it's not necessarily an easy thing to learn because our emotional reactions tend to be very automatic. So it's learning to slow that down. With kids, often what I'll do is teach them to pause in easy situations first. Like if I were to ask everybody in here to make this audience participation here, I'll ask you a question and just call out your answer. What's your favorite color? Okay, everybody did that really, really fast. Okay, so same thing, same question, but before you answer, just take a breath. Maybe a breath that even your neighbor wouldn't even notice, but take a breath and think about your answer. Maybe see it written in your head or picture that color before you answer. Just 2 seconds, pause. All right, what's your favorite color? That's more than 2 seconds. But you get the idea. When you pause, you slow things down, and it has a calming effect. When the child can learn to do this with really simple things like that, and you can make a game out of it. You ask a question, you say pause, and then they do it. And then you can have them do that with you too. So whenever they want to, they can ask you something and say pause, and you have to pause for just 2 seconds before you reply. So that's a really good way to teach the power of pause. And then when they learn that, it's helpful to say, okay, do you think you're ready? Because they will get bored with that. So after a week or so, you might ask, do you think you're ready to apply that to something harder? And hopefully they say yes. And then you can start doing that. Okay, can I go over, to play with Joey next door? And then you say, I'm going to ask you to pause. And then, no, you can't because we're getting ready to eat dinner. And so now they have to pause when they hear a no. So just teaching them to do that and teaching them that when they don't pause, say, okay, you're still learning. This is a skill you're still learning. But I know you've done this in the past. And that brings me to the second one, which is do-overs. If a child has an emotional meltdown or doesn't manage to do something they were supposed to do, it's really helpful to have a do-over. Not in a punitive way, but it really has to be when the child's calm again. Like if they've had an emotional meltdown, sometimes it might be an hour or more till they're calm. But if they come out and they're apologetic or sorry or regretful, this is, you know what, let's just do this over and have a quick reenactment, very short, under a minute. They say what they said, and then you respond, and now they respond in the way. Have them figure out how do you wish you would have responded, and then do it. And when they do that, you celebrate. Yes, great. How did that feel? The ADHD brain's a show-me brain, so now they can see it, and they can experience it, and they can remember that. They have now done that thing, and they've shown themselves, I can do this. Because it's very easy for the child to say, I'm so sorry. I know I got way too upset. I won't do that next time. And then when it happens again and again, they start to not believe themselves. So this is a really good opportunity for them to prove to their parent, their teacher, themselves, I can do this. It's possible. And okay, the last two, harsh inner critic and wins, go together. I told you earlier that overwhelm is a word I hear most often. The other thing I see most often with ADHD, again, not everybody, but most everybody, is the presence of what I call a pretty harsh inner critic. There's a statistic out there. I can't tell you where it came from. I can't guarantee it's true, but it's estimated by the age of 12, the average child with ADHD has been the recipient of 20,000 more negative comments than their peers. You can imagine the effect that would have. A lot of kids and adults with ADHD become people pleasers. They try to anticipate what could happen and not mess up. They also tend to acquire that those negative voices become their voice in their head. And it may not be obvious, but when you ask them, how are you feeling about yourself when something's gone wrong? And often they will say, really bad. So it's really important to teach them that that's not the truth. It's one perspective. It's one way of looking at it. And a really valuable question is, what's another way to look at that? Let's use the example of an emotional meltdown. Said I wouldn't do that. I did that again. I failed. Okay, what's another way to look at that? And they may need some prompting in the beginning to get to, I'm still learning that. I'm working on it. But I'm talking about it now, and that's progress. So the wins, all the coaching that I do is via Zoom, but I have a little win bell, which looks like one of those little service bells you see at a hotel, ding. And what we do is when there's a win, I ring the bell. And most kids, adults do honestly love this. And what it is just an auditory, sensory way to really celebrate a win. And the definition of win is very simple. Literally anything you feel good about doing. Doesn't matter if it's easy for 95% of the population. If it's hard for you, that's a really big win. But it could be anything that's on your to-do list, anything that you've been working on, anything at all that you feel good about doing. What this does is helps set in motion those days we talked about earlier, the day when you feel like, hey, I'm on top of things. It helps set those in motion so that you can get some momentum going. And you can even use this to create a win. Having a rough day, let's create a win. Okay, we'll look around you. What could we do? Well, I got a stack of clothes here that I need to put away. All right, put those away. And then, ding, all right, there's a win. Now you got some momentum going. And so teaching, again, not just the kids being a recipient of, that's a win for you, but them learning to recognize it as a win and call it out as a win. That's when it really starts being powerful. So that's pretty much it for mine. I'm going to pass the mic over here to Dr. Christy Briscoe and let her take over.
So I'm a general pediatrician, and I've been working with families and children with ADHD for over a decade and longer than that. It's an enjoyable thing to do. These kids and families come often needing a lot of help, a lot of encouragement. Probably the most thing they need is encouragement. So when I'm working with families, I obviously, a big part of what I do is treat them with medication. But as I have, not close enough. As I talk to them, I emphasize that it's actually really important to not just treat with medication, because medication alone is only going to do a portion of getting these kids to a point where they are improving and really making sizable gains in developing these skills that Pam's talking about. Because often they are failing, they have struggled, they are used to, like Pam said, being criticized a lot, both internally and externally, whether that's by teachers, parents, grandparents. Everybody has an opinion about how they should behave, and that's often a struggle. So when I am working with families, one thing that I try to help them understand is that these kids are probably the most difficult kids to motivate. And so understanding that there are ways to help them be willing to do tasks, be willing to do the things that they've failed at, and helping them care is a big part of treating these kids. So obviously medication, we want that to work, but it doesn't always work quickly. And so by being aware of things like growth mindset, that is something that can really be helpful in getting these kids to be willing to try. So I'm sure you guys as educators are aware of what growth mindset is, but it's just that general idea that most kids can improve with effort and with trying, and the idea that as educators and teachers and parents, they have a huge role in linking the kids' effort to their improvement and to their gains. So whether that's something, a tiny task like brushing their teeth, or something bigger like working hard on an assignment or a writing assignment that they're really struggling with, just helping them see those tiny little bits of gains helps them be willing to continue that effort down the road. So really that focus on effort is important. And so another part of what I do with parents is try to emphasize how they need to build bridges with educators. So obviously you guys are with these kids for 7+ hours a day. And with some of these kids, it's a lot of work, helping keep them on task, redirecting them, helping them see the purpose in doing the work is hard. And so helping communicate with parents is very important. Obviously, some parents are more receptive than others when it comes to hearing about their kid. But saying, not necessarily criticism, but both, helping the families see that communicating with you all is a valuable tool, and just continuing to build that bridge. Some parents are very receptive, some parents are very hesitant, but being gentle with those that are hesitant to hear that feedback and helping lead them to see the purpose, the why of why it's important to seek treatment, why it's valuable, maybe stories you've experienced with other kids that have struggled, and things that have helped them or kids in a similar situation might be helpful in building that bridge with that family. Is this on here? I think it is. So one of my favorite tools that I have used with families and teachers actually over the years is this chart. Excuse me a second. It's called the Mistaken Goal Chart. It is straight out of Positive Discipline by Jane Nielsen, which is one of my favorite books to help parents who are trying to encourage their kids with ADHD. The value in this chart is that basically when kids, whether they have ADHD or not, have misbehaviors, it's often because they don't feel either a sense of purpose or a sense of belonging in their environment, whether that's school, home, a sport, whatever. So this chart really helps identify those 4 primary mistaken goals that kids experience. And the way that this chart can be used to start is that second column where it says where the parent or teacher feels, and then using those feelings to help identify what that mistaken goal chart or what that mistaken goal is for that child. The main reason I wanted to bring this up today is it's very practical. So as you're identifying these mistaken goals in children, they tend to be cyclical. So unless they are provided and taught new and different strategies, they tend to repeat the same behaviors. So one of the main ones that is hard as a person who treats kids with ADHD is when kids don't care because they failed. They have messed up. They know that they are not your favorite kiddo. They know that they're difficult. They know that they're behaving in ways that are negative. They get that feedback. It's not hard to see as a kid. So when they stop caring, they give up. That's really hard. So that's one that I see a lot in kids with ADHD, especially when they have other things going on that make it difficult for them to learn. So I just wanted you guys to be aware of this chart because it's so practical. It's very easy to read, and it's shown to be beneficial in many families and many educators that I've shared it with over the years. So that's why. Yes.
Can you tell us again where we can find that chart?
I think did we provide it?
Leslie said she would provide us a handout, but it's Jane Nelson, positivediscipline.org or com. I can't remember.
Yeah. It's positivediscipline.com, has a lot of good resources on it, but this, I think it was provided for you guys, I hope.
It'll all get emailed to you all.
But it's my favorite. That's why I wanted to share it. And that's most of what I was going to talk about.
Let's see. I'm Dr. Brian Briscoe, and I'm an adult psychiatrist, so I don't work with children, but I do work with a lot of the parents. And so I'm going to make 3 points. The studies show that you only remember 3 things that I say, and so that's all I'm going to say. But we'll have a lot of time for questions afterwards. So the first point I wanted to make is that most children will not grow out of ADHD. If I gone in medical schools 30, 40 years ago, was taught to physicians that kids would just grow out of it. And so we have a lot of parents coming to us now that say, I see this going on in my kid. I'm kind of wondering about myself, but nobody said anything about it. And when we start looking and asking questions of their parents, we see a lot of ADHD traits. The reality is that studies that have been done over the last 20 to 25 years have shown that 50 to 70% of childhood cases of ADHD progress into adulthood. And that's pretty well established in our literature at this point in time. The second point I want to make is that it's very important when you're looking at an older teenager getting ready to go to college to start preparing that teenager for that transition into full independence. Many times with parents of children with ADHD, you'll see a pattern where the parents are providing all the structure. They're chasing the child around, making sure they get their homework done. They're making sure they get up out of bed, going to school. They're making sure that they're planning everything out in their week, getting to practice. And that's got to stop, because if it doesn't, when they go to that freshman year of college, they're going to really struggle, because all that structure is just going to disappear completely. And so one of the things we try to do in coaching is to try to help the parents to gradually taper the structure that they're providing in the junior year, and especially by the December of their senior year. Most of that structure should be removed. The parents should not be waking the child up in the morning. The child should be getting themselves up, getting themselves to school. And if they don't go to school, they've got to learn to experience a little bit of that consequence before they go to college, and they can be on a free-for-all. So just, yeah, well, okay, I made my point. Last point I want to make is look at the parents. This is the most genetic illness of everything I deal with in psychiatry. The heritability of schizophrenia and bipolar disorder. Heritability is the percentage of a condition that's due to genetic factors. The heritability of schizophrenia or bipolar illness is about 69, 70%. Heritability of ADHD is about 72, 73%. So it's higher. I'm not sure if that's the exact number, but it is the highest heritability of any condition I deal with. If a child has ADHD, there's a 50% chance that one of the parents have ADHD. So look at the parents, and a lot of times if you can get the parents in treatment, things will improve in the home, and they'll improve for the child as well. Okay, that's all I have to say for now. Time for questions. I think we had some cards. Yeah.
One that was online. So they were asking a current preferred designation for ADHD. So like disability, illness, condition, challenge. Like what would you say is the preferred designation?
And please repeat the question into the microphone.
Good question. So when I talk to families, I mean, it is a disability. The reality is that's what it is. But I try to help families understand that with empowerment, there's nothing that kid cannot do. So, you know, and I speak to kids and I explain that to them as well. I try to help them see it as a superpower. So, but it's one that it's important that they have certain accommodations. And just like we've discussed, you know, as kids are growing, they may need more accommodations earlier, but the goal is for them to need less and less, if that's possible for that particular child, as they grow. So but I would still consider. I mean, it's a long-term chronic disability, is what it is. Anybody else want to comment on that?
I like your comment about superpower. I mean, it is a disability, but it's important that we emphasize some of the strengths that people with ADHD have in dealing with adults. I will many times see very, very successful individuals who think outside the box, who can think on their feet and come up with incredibly creative solutions to things that people who are more obsessive like myself, we can't even think that way. So there are strengths and weaknesses that people with ADHD tend to have. I think we have to be careful to acknowledge the weaknesses for what they are, but also not to leave people feeling as though they're inferior in some way to the rest of the population. So.
Should we collect cards?
Go for it.
I would write on the card. I did. If we can just hand it to them, that way they can read it, and the people online.
Yeah, so pass your cards down to the end, and then we'll swoop them up and carry them forward. Okay.
So this question is, any suggestions for building independence in middle school? Yes. So what I tell families is that obviously kids need to develop those skills, whether it's 6th grade or 8th grade. We're trying to develop skills when the child is ready to fly and ready to actually be ready for that skill. As we've talked, it is, it's critical that we don't have too many skills at once for these kids, because then they're just going to flop and fail. So really helping identify, say there are 5 things that this kid struggles with. So they can't remember to turn in their homework. They can't remember that they have homework. They don't write in their agenda. They use the backpack as a black hole, right? So identifying with that family, with that child, ideally, both of them, because to me, I see the family as kind of an accountability partner. Both the teacher, special educator, resource, whoever can help serve as an accountability partner for these children can help develop these skills and build them one by one. But it's important that they become strong with one skill and feel good about that and really focus on that before they start working on that next one, because it's very much peeling back the layers to help them feel successful and help them feel capable. And that's a word I haven't used enough, but these kids really have to feel capable of doing something before they're able to actually continue and are willing to continue to do it. Anybody else want to comment on that?
I just add one thing to that, is that sometimes it's important to look at who does the child work best with. And at the middle school age, often they're still working really well with their parents, but sometimes they're at that age where a neutral third party really comes in handy. And that might be a teacher or a school counselor. It might be a neighbor, someone for their church, or ADHD coach, but somebody for whom the child can feel supported and they're open to suggestions. I mean, I've had parents, as parents, we'd lay our lives down for our children, but sometimes we're the last person that they want to hear from. So it just depends on the child, but it's really important to find someone the child is open to working with. Got lots of questions.
Yeah. Working on it. Okay. So I'm going to just go through them, and then if anybody else wants to comment. So ADHD meds is a cardiology screening necessary prior to starting meds. And what age can meds be started? So technically, I'm going to answer the second one first. So medication can even be indicated in preschoolers. So impairment, meaning a child is behaving differently in terms of attention, hyperactivity, in a significant way that's different than their peers, meaning they're not able to be in that environment and be successful. So if a kid's not successful, whatever environment that is, even dating back to preschool, they really deserve to be. So, and we know that ADHD is very important. Medication is a huge, huge part of ADHD treatment. And without it, they're not gonna have the same success as kids who are not treated. Obviously, the goals of treatment are different for a preschooler than, say, a kid who's 16, 18 taking their ACT. But the goal is still for that child to feel successful. The other part of the question is a cardiology screening necessary? Not in most cases. If there is a significant family history of structural, like cardiac defects, arrhythmias, significant, then yes, that would be something that I would recommend a cardiology screening and or EKG for, but the majority of kids do not have that history. And it's not like my grandfather had a heart attack at 55. It's actual significant structural defects of the heart or arrhythmias. Do you want to comment on that? Okay. Okay, the next one is medication shortage, still a problem. Less so than it has been in the last six months or so in my recent experience. The majority of us can find medication for kids that we need, and there's some options. If a particular medicine is not available, there's usually an option, whether that's a branded medicine or switching across categories of medicines. Anybody else? Okay. The second half of that one was, how long do you give new meds before trying something else? Is 2 weeks long enough? So, to me, this depends on side effects and a kid and parent's experience with the medicine. So, again, doing this and having experience with it for years, I know what I'm expecting, and I know what I tell families to expect. So, and we also talk, like I talked to you guys about other things like positive discipline, growth mindset. Kids who have experienced failure, who are not trying, all I ask for them to do at a visit is try. Literally, that's what I say. I say, your job is to try. I'm giving your parents this homework. You try. Because if you try, then I can do my job. My job's the medicine, your job's trying. And so that's what I try to emphasize and help. So if there are negative side effects, then we think switching earlier. So there are personality changes that can happen with medicine. If kids, if they start to become irritable, grumpy, if they're not themselves, parents aren't going to like the medicine. If kids experience a lot of stomach discomfort, headaches, belly aches, I'll usually go down on dose if there's not a big other negative. But but as far as a 2-week trial, it's hard to say. It really depends on the particular situation with that kid. But there's lots of options with medicines. The goal and what I tell families is that we help your child focus, but we don't change who your child is. So the goal is not to create a zombie. The goal is not to create a child with a different personality who isn't social, who's not able to communicate with friends. The goal is to do the opposite. The goal is to help these kids communicate, help these kids be social, help these kids be successful with school, help them feel good about themselves. That's the ultimate goal. Any other comments?
One of the most important things I think we can say about medications is that medicines are very helpful in terms of in my clinical experience. This is kind of what it would look like for improvement, this being 100% and this being where kids or parents are starting down here at 0. Medicines, we tend to see about 60% of the improvement total, but to really get from 60 to 100%, some form of coaching or cognitive behavioral therapy for ADHD really is necessary, and I see that very consistently. A lot of times parents, adults, or children will just take medicines and kind of expect this magical effect in everything in their life to change, and that just doesn't happen. The kids or the adults may be more focused, they may be able to get more done, they may feel like they're more, they're able to stay on task better, but pills don't make skills. It's not going to help a child or an adult improve how they manage their time. It's not going to help them develop new strategies for staying organized. It's not going to help with that sense of overwhelm. But we see time and time again where it's a consistent issue where they take the medication, they get this dramatic change, and they just settle for that. And they're really selling themselves short. I had an adult patient once who used the term, who said something like, it was night and day to start the medication, but when I went from the medication to going through coaching, it was like going from black and white to color in The Wizard of Oz. It was just a dramatic difference. So I just can't emphasize enough either doing some form of therapy, cognitive behavioral therapy for ADHD, or some form of coaching for the kids or the parents. If you really want to see life-changing kind of progress. So, okay. Oh, treatment. Well, it says a question was, Dr. Brian Briscoe mentioned treatment for parents. What kind of treatment? So a combination of medication and coaching, or medication and therapy. We tend to involve, coaching is usually sufficient for when we're dealing with ADHD without a tremendous amount of co-occurring conditions like severe depression, anxiety, or bipolar disorder, other kinds of complicating factors. But if there are other factors like severe trauma that a person has experienced or severe anxiety, many times we'll refer for psychotherapy as well. So, okay. Nope, I'm getting more questions. What is the best way to get an adult to seek help for ADHD? Well, yeah, it's usually people delay. One of the best things is seeing a friend or someone they know get treatment, and then seeing the improvement firsthand, or seeing their child improve after the child gets treated. But you really can't force anybody to do anything they don't want to do. But that's the best example. Is just hearing about success stories or witnessing it in a family member or a loved one or a friend. You want to take some of these?
These are you. Yeah, those are you, though.
Okay. So one of them came through, what accommodations for early stage, like kindergartner. So I think I mentioned it a little bit before. I mean, based on the kid's developmental age, things that you're wanting them to be able to do are going to be harder for most ADHD kids than others. So just a lot of do-overs, a lot of lowered time. So say you expect a normal neurotypical kindergartner to sit and color, or sit and try to write letters for 10 minutes. An ADHD kid might be able to do that for 30 seconds. And so, but they can build. And the important part is they understand they can build. And you're helping them see that they're building, and you're helping them see that the letters are getting easier. And so very much it's just lowering that expectation for the skill, helping them see that there's benefit and the why in what they're doing, and connecting, like I talked about growth mindset before, connecting the, what they're doing, their effort, to actually feeling better and feeling more skilled with whatever it is. I hope that is specific enough, but it's just basically, lowering the expectation, helping them gradually gain each skill, starting from the most important to the least important for them. And then one question was, what advice do you have for us when parents refuse medication and accommodations aren't working? Ha ha, that's a good one. What advice? Pray. So it's hard, because again, I think I'm going to go back to what I talked to you before about bridging that gap. So you have there are plenty of people who still don't believe ADHD is real. There are plenty of people who haven't had a close enough contact or close enough family members or anybody in their lives that leads them to even believe it's real. So and far be it for them to treat it, medicate it, and it's hard. But as a teacher, developing relationships is very much what I would say. Gaining the trust of that family. I do it when I see families all the time that come to me and they want to do coaching, they want to do everything but medicine. And so what I generally do is I set goals and I help them. I use that word success. Say, I want your child to feel successful. Does your child feel successful? And then usually not really. So, okay, you want to try without medicine for a little while, that's fine. These are some things I'm looking for your child to show us that what we're doing is enough, whether that's accommodations or coaching or whatever it is. And then if we get down the road and they're not experiencing success, or the parents are more aware of the red flags that I'm watching for, the kid, negative self-talk, I can't do anything right, no matter what I do, I fail, those kinds of things are things we don't want to come out of our children's mouth, or our students' mouth. So developing relationship, and very much the positive discipline that I briefly referred to is very much relationship based. It's effective for both kids. It's effective to communicate with parents. It's effective to communicate with spouses. It's a good form of communication, but that relationship is probably going to be the best thing to eventually have enough trust with that family where they might listen to you, or they might hear a story, or they might hear something that you have to say about why they need to do something, or what could be different for the child down the road. So that's one. I did that one. I think there was another one. So there's one about a coexisting diagnosis with ADHD and autism spectrum. So there certainly can be. We don't specialize in autism spectrum in our office. It's not if there's autism spectrum, there's a lot of other early behavioral interventions that are useful and helpful. But certainly there's ASD is a very much spectrum, so is ADHD. And there is some overlap in some of the symptoms. It's something that is very important to be aware of, because if autism is present, they really do need some more intense behavioral interventions than does your average child with ADHD. Do you want to say anything else?
This is a good question. How much do you see ADHD symptoms that are actually the result of anxiety and vice versa? Yeah, that's a great question. Sometimes we will see folks that have been diagnosed with ADHD where it could just be an anxiety disorder, generalized anxiety. They're so preoccupied in their mind that they're not able to kind of focus on what's in front of them. Sometimes we do see that. And on the other hand, we sometimes see folks I sometimes see a few adolescents or adults whose anxiety tends to really be this sense of overwhelm that Pam was speaking about. The things are piling up on them so much, they're just always feeling overwhelmed because they can never get anything done. And when you treat the ADHD, the anxiety just mysteriously dissolves. So I think it just speaks to the importance of having a comprehensive evaluation by a mental health professional to really kind of parse things out. And then not relying just on that initial evaluation, but following the child or the adult over time, 6 months, a year, and just seeing how things progress. It's many times that when we come out of that initial evaluation, we don't know for sure. And we just have to kind of watch how things go and watch the progress, and then things become more clear as things go. So, yeah. How to manage medication when it's combined with increased anxiety. Should we change medications and add anxiety medicines? Well, that's what I have to sit around and worry about all day. It's a good question, but I think just relying on the physician to make those judgment calls. Sometimes many times we'll treat both if they're both present, but I go back to that comment about just watching how things progress over time and treating what is really truly there. Yeah. And we're not just using medications. Usually it's a combination of some kind of therapy or coaching if it's a more simple, straightforward case, and medicine when it's needed. So.
I was just going to say, it's anxiety and ADHD often do come hand in hand a lot. Most people would say treat the ADHD first, just because the anxiety, like he said, often will dissipate. It'll go away, sometimes completely, if we can actually adequately treat their ADHD symptoms. Because, these kids come in and they're worried about their projects. They're worried about putting things off. They're worried about not finishing things. They're worried about their teacher getting on them. They're worried about getting in trouble with their parent. And so if we can eliminate some of that struggle, even by 50%, which is what medicine, the goal of medicine is, we can help them be less stressed. And obviously in cases where that's not improving or anxiety or specific anxieties are present, then we obviously have to treat the anxiety too, to help them be most successful.
The pendulum may be a little swing a little in a different direction on that with adults, because adults tend to have more complex backgrounds and history of trauma and other kinds of co-occurring conditions that have added up over time. So we may tend to treat the anxiety a little bit more first in adults than in children, but not always.
Any other questions?
I'm still writing, but is there harm in taking summers off? Where, speaking personally, son with ADHD too, and teacher. Not usually doing meds in the summer. Sometimes not on weekends either, depending what's going on. Is that too much back and forth? Is that going to screw him up, or depend on the kid? What do you think?
Can I take a shot at that first? You can take a shot at it. I'm going to speak to that in adults. ADHD affects every aspect of life. That's usually what I respond when people ask that question, can I take the day off? I say, sure, if you want to take the day off, but it's affecting everything. People are often not aware that people will take the medicine to help them with the work or their school because they see the results, but people may not be thinking about, okay, how's this affecting things at home? Other subtle things people don't think about. The accident rate for folks, car accident rate is 3 times higher with untreated ADHD. So in children, you may speak to this more, accident rates with ADHD kids, you're talking about much greater risk of broken bones, all different kinds of things that can happen. So I'm not, I tend to just suggest that, and people are free to do as they please, but just be considering that it's affecting everything and not just school. So, yeah, okay.
So when I meet with kids, even from a young age, I'm trying to help that kid be engaged in their diagnosis for the rest of their lives. So if I force a kid to take a medicine, or I force a family to give a medicine, there's going to be a lot more resistance to that medicine. So in the same, I had a girl I saw yesterday. She's 12. She's doing great on medicine. Her mom's fully aware that she needs it, but the girl's like, I can't tell the difference. And so she wants to take time off. She wants to take summers off. So what I'm trying to do with her is encourage her during the school year to take the medicine every day. We talked about goals of treatment. We talked about ADHD existing on the weekends. We talked about the things that she's going to remember to do, like reach out to her friends and make connections and do social things that she might not remember to do if she doesn't take it on the weekends. But I want her to be looking for the things that are the reasons that she's going to need to take that medicine over the long run. I want her, from the age she's 12 to 18, to be fully engaged and understand the value of that medicine, and that it was important for her on the weekends as she's an adult down the road, and definitely needs it. When we talked, I said, well, she's 12. She's not driving. There's not an indication that she has to take this medicine every day. It's not an emergency medicine. Does she have any negative or unsafe behaviors or impulses that put her at risk or others at risk? So we went through those things, and if those things aren't present, then it's not unreasonable for her to skip a dose and just watch and see what happens, and to see if there's a reason to take it for her every day. There are some patients that I take care of, some families I take care of, and I tell them, watch over the weekend. More importantly, watch on Monday and Tuesday. If the kid's more tearful and grumpy and irritable on Monday and Tuesday after skipping out a weekend, probably not a good idea, because you're creating a cycle that's negative and you don't know why. But so at the beginning, when I start medicine, I always say, give it every day. See how you do every day. And then if you know and you're stable and things are going well and you want to try it off a weekend, or you want to give them a medication holiday, like in a child that's not eating great, you can try it. But there's also other things you can do to help kids eat and provide help with appetite and other things that can help that kid have a successful experience on medicine. So that's the other part that I talk to families about. I say the goal is to find a medicine you don't hate. You don't, you guys like taking, that the kid enjoys taking because it helps them feel successful. It helps, they see a purpose and a value in it. And then the parents also have their kid. They have their kid with their personality who likes to laugh at jokes, who's social. And so there's not negatives. If they're negatives, or if kids are wanting to skip weekends, I'm thinking there's side effects they're not telling me. So then we go down that path and try to figure out why they're not wanting to take the medicine or why they want to take summers off. Because most of the kids that have an effective medicine that they enjoy taking don't want to take time off. They recognize the value of the medicine.
Let's do the one last question we had, and then we'll
Okay.
wind down. I forget who passed that last one.
You want to take that one?
We hear frequently that ADHD diagnoses are increasing. What, in your opinion, is the role of digital devices? Do they worsen symptoms? This has been studied, and the studies that have come out to date, the answer to this question has been no. Digital devices are not worsening ADHD. I do think it highlights it. That's about all I can answer based on the studies. Yeah.
I would add to that this comes up in coaching a lot, especially with teenage boys. And I mean, pretty much anything can get out of hand for us as human beings. And this is one I see that happens a lot. And so it's really important for parents to feel empowered to make rules and set limits. That doesn't mean they have to ban video games, but homework may need to be done first, and there may be a limit on the amount of time that's spent on that. It doesn't cause the ADHD, but it's often getting in the way. That happens to be the thing that's getting in the way of the child focusing it on anything else. Can become like an addiction to them. Do you want to add anything to that?
I would just add that a lot of kids are motivated by their tech. So using it, parents ask me all the time, how do I get them off this without having a tantrum, or, those types of questions. And so when I'm talking to the parents, when I'm talking to the kid, the goal is to teach them behaviors that they can have and that are productive. So I want the parents to be able to set some boundaries where when they need to shift, when they need to transition to something else from a preferred video game activity to a non-preferred school, academic, pick whatever activity, the goal is that the child can do that and transition without a tantrum, without fussing, without fighting. So if that's happening, then the way I express it to the kids is you can't have it as long. So let's see how long you can have it without having a tantrum, without having a disruptive behavior. So if you're having that, the goal is to not have those behaviors. So you obviously can't have it for 30 minutes. Maybe you can do it for 25 minutes. And so the word experimentation has been used a lot. I think it's useful for kids to know that they're kind of in a constant state of experimentation to see what they're able to do and what they're not, with a primary goal of the behaviors that we want to see.
This was fantastic. Thank you so much. Let's give them a round of applause. What a great presentation. Thank you.